Dr. Niccole Bruno. Welcome to Companion Animal Hospital in Spring, Texas. So this is our lobby. Usually when clients come in, my receptionists are the first people that they see, and so they greet them and they will take their pet and they walk up to the scale so that we can get a weight on them, and then we eventually go into an examination room. So we have 3 rooms here. This is our cat room. We try to separate where we have our cats and dogs because there's smells that cats can sometimes be afraid of. So we usually do our cat appointments here. We'll have a discharge room, and then our other room, which is currently being occupied, is for our dogs. So if you want to come up in the back, one of the things about a veterinary hospital is we usually have a full pharmacy, so that we, at least when we're diagnosing and treating, we can offer those medications so a client doesn't have to go to a pharmacy. Sometimes there are diseases that require them to go, and so I do write prescriptions for them to go. This is Avery, one of my nurses, and she is setting up my next appointment. But this is our pharmacy, and we do have a lab. So if patients come in ill and we need to do blood work on them, we will be able to run in-house blood work. We can look under the microscope at slides of cytology, if I do an ear slide, or even fecals. Sometimes pets have diarrhea. We need to diagnose what's going on with them. So this is kind of our area where our technicians tend to work. They set up vaccinations. This is my next appointment. This is my office. But if you come follow me in the back, this is where usually all of our major procedures happen. We are able to do x-ray, and one of the things that is cool, we have digital x-ray, and so today I actually did an x-ray, a recheck x-ray on a dog that the owner ran over her foot about 8 weeks ago, and so this is our recheck of the x-ray, and it's still fractured, so we're still splinting, but at least the dog didn't need surgery. Right here is kind of where we prep for surgery. We've got a little puppy that we're gonna do some vaccinations on later. And then that's Briley, say hi. She's a Rhodesian, she's really cute. And then this table kind of allows us to do procedures, even like laceration repair. Sometimes dogs get into fights and they need to be stitched up, and so we will do some things here. We can take blood here. This side over here is where we usually do our prepping for surgery. Sometimes we do dental, so we have digital dental x-rays and we have our overhead lights. So between that and the anesthesia machine, this is usually where I'm doing a lot of my dental work. And then if it needs to go into surgery, we do have an OR. And so right now our anesthesia machine's out here, but this is where we really do a lot of our surgeries. That's us in a nutshell. We do boarding in the back, but mostly my focus is on our treatments and procedures and preventative care. So that's where my examinations are. And that's kind of where I gotta go. So going to do some vaccines right now. Thanks for coming on the tour with me. Hi, my name is Dr. Niccole Bruno. I am a veterinarian at Companion Animal Hospital in Spring, Texas. This is my dog, Jimmy. Being a veterinarian it's a position that we diagnose and we treat animals. We do it the same way that human doctors do. We have the same equipment, blood work. We can do in-house blood testing. We can do x-rays, ultrasound. We do surgery. We diagnose multiple diseases and also talk to clients about preventative care. One of the things that I always make sure that I tell students about being a veterinarian is that people think that it's all about just the animals. And yes, I do love animals. Yes, we treat animals. But a major part of my job is client communication. The clients are who own the animal. And so unless I can convince them the need to do certain tests or convince them of why their animal may be presenting in a way that requires further surgical procedures or anything, I really have to explain my medicine to them. So most of my day is, I do examinations on pets, but really the crux of my day is talking to clients on the phone or in person, reviewing blood work with them, making treatment plans. I have a wonderful team of technicians that can do anything that I ask them to do as far as the x-rays or taking blood. But really, I always try to stress that to my students, that there are animals, and it's a huge, my whole day encompasses animals, but for the most part, a lot of what I do is client communication. As far as what it takes to be a veterinarian, it does require veterinary school, but before we go to veterinary school, we usually complete 4 years of college at a university. You can apply to vet school just with credits, and you have to really look at some of the veterinary schools to see what type of credits you need, because some of them may vary. But I usually recommend getting a 4-year degree because of the fact that veterinary school is very challenging to get into. Sometimes you don't get in the first time, and you always want to have a backup plan. So at least if you have a 4-year degree, you have opportunity to go on and get a post-bac or do a master's. You can even start working at an animal hospital or do something else, but you at least have the degree under your name. As far as testing, you take the GRE, you get into veterinary school, and it is a 4-year program. When you finish veterinary school, the difference between us and human medicine is that we're not required to do an internship. And I think that that's something that we tend to do at this point. Most of my colleagues have come out of veterinary school and have chosen to pursue internships, whether it be in academic institutions or in private practice. I chose to do an internship at a pretty busy animal hospital in Long Island, New York, and I really appreciated that time because it taught me a lot past veterinary school of how to practice and, most importantly, when to refer. There are some of my colleagues that go on and do residency programs, and just like in human medicine, we have similar programs. We have anesthesia, we have cardiology, dermatology, internal medicine, surgery. So all of those subspecialties require additional training of 3 years for the most part, and when they get out of their residency program, they sit for their boards and they become board certified. I am a general practitioner. I didn't see anything that I wanted to do full time, and I actually think that I appreciate being on the forefront. I appreciate being the first person that clients see, that they trust me to kind of educate them on the care that it takes to have an animal, also any disease processes that they can prevent, and also if they need to have additional treatment done elsewhere, then they trust me first to refer them to the right places. So I take what I do pretty seriously. I also really enjoy doing a lot of different specialties, so it was one of the reasons why I didn't choose to do a residency. But most of my interests include medicine, dermatology, dentals. And so here, Jimmy just had his dental done a couple weeks ago, and we use the equipment back here. We use the same anesthesia. Well, maybe we don't use the same anesthetic machines, but we have anesthetic machines, and we have digital dental x-rays, and we are able to diagnose and treat dental disease. So one of the differences for me as a general practitioner is I'm kind of like a jack of all trades. I do surgery, I do internal medicine, I can manage diabetes and kidney disease. I enjoy what I do, and then when I'm not able to do certain things, I end up referring. Most people that are veterinarians knew when we were very young that we wanted to enter this profession. I knew at the age of 12, I went to my mom and I said, I think I want to be a veterinarian. And she asked me, do you know what that is? And my mom's a teacher, and so she got all these books and I was reading up on it. And the one thing that she said to me was, do you think you can handle what it takes to be a vet? And I was like, of course, I can treat animals. But it is a lot more, and I think what she was referring to is euthanasia. The act of euthanizing an animal is basically putting them to sleep, ending their life. And that is something we don't take lightly. It's something that we offer when an animal is truly suffering. And sometimes they do need to be euthanized. So sometimes there's just disease processes that are bigger than what we can treat. And at that point, we offer owners the option because their pet is suffering. And when that happens, it is very emotional for the client, and of course, sometimes on us. And I always tell myself that if I get to a point that it becomes too comfortable for me, then maybe I need to move on. But for the most part, sometimes I'm crying just as hard as my clients. But my mom really wanted to make sure that I understood that that was part of being a veterinarian, as well as doing surgery and making sure I could handle blood. So we called around, and my mom drove me up. I'm from New York. My mom drove me up to Yonkers, which is outside of New York City. And I met with 2 veterinarians from Tuskegee, and they showed me what they did, and I was so intrigued. And after that, we got books, and I learned that it was really hard to get into vet school. And so the things that I could do, which were volunteering at animal hospitals or at shelters, is what I did. And I logged those hours, and I ended up going to Tuskegee University for undergraduate. I majored in animal science. I graduated in 2002. And I, as a New Yorker, I applied to Cornell, and I applied to Penn, and I applied to Tuskegee, and I got accepted to Cornell. And I ultimately chose to go there because I thought it was time for me to go back home to New York. And I truly enjoyed my experience there. I learned a lot. Being from 2 different schools that actually had veterinary schools was definitely a great experience for me because I learned a lot about farm animal and rural life being at Tuskegee, and then I learned more what I decided to ultimately focus my veterinary pathway on, which was a companion animal, and so that was at Cornell. After Cornell, I did an internship for a year in Long Island, and then I settled in New York for practice for about 11 years. And 3 years ago, I moved to Houston, Texas, and so now I work here. A lot of people hear that it is challenging to get into veterinary school, and it's really because there's not a lot of veterinary schools in this country. When I applied, there was only 28 veterinary schools, and then there were some vet schools overseas, and so that includes Ross, and that's in St. Kitts. And there's one other one, I'm slipping my mind, but now there are 30 veterinary schools, and I believe they're building 2 more, one here in Texas and one ironically in New York. And but still, when you have many applicants and only few seats, it makes it challenging to get in. And so you could be cream of the crop from your undergrad and still not get into veterinary school your first time because there's just so many more applicants and they have to make decisions. Some vet schools will interview and some will not. And so when the ones that don't, you really have to look good on paper. When I give talks to students about getting into veterinary school, I really emphasize that grades are good. You need to have your science grades. The higher your GPA in your science classes, the better. But really what you do outside of veterinary medicine or your classes speaks more. Are you well-rounded? Are you in clubs and activities? Are you doing volunteer work? Are you getting animal experience? I mean, the more animal experience you can have before you get into veterinary school, the better. And the more you can actually show that vet school that, hey, I've looked at, not only have I just worked in small animals, but I've worked with cows, horses, pigs, chickens, goats, lab animal, and these are all things that I did before I got into vet school. So when I was at Tuskegee, I did internships. I went to Iowa for a summer. I went to Chicago for another summer. And so I was able to really have a strong resume going into vet school, and that's what I really emphasize to kids. Like, if you know at 12, then make your plan now, because that's ultimately going to help you get into vet school. So when it comes to salary for veterinarian, it's a huge range. There are a lot of specialties, as I talked about with, you can specialize and be an anesthesiologist or dermatologist. And so because they've done additional training, they usually make more money. As far as location too, if you live in Montana versus living in New York City, that plays a role in your salary as well. Also, being in a veterinary profession, we have the opportunity to do different pathways. We can go into academics, government, corporate, private practice, and so those all will allow for different ranges. And experience comes into play too, especially with private practice. If you're 2 years out of vet school versus 14 years like myself, we're gonna command 2 different salaries. On the average, when I looked it up, because again, I've been fortunate enough to work in 2 major cities, so my salary has always been a little higher than what the median is, but right now the median is reported at $95,000. I think the best part about being a vet is, and probably the only other human profession is like a pediatrician. It's like you're able to fix something that can't speak. You're able to listen to what a client says, and sometimes they come in with their own version of the story, and you hear it, and you can always hear the same couple things, and you're like, I know exactly what's wrong with it, and I can fix that. And that's a good feeling. And it's a good feeling when you call them like in 2 days to see how the pet's doing. They're like, oh my God, they're doing great, thank you so much. And that's such a great reward, because you know that you're doing right by it, and you're using your knowledge. The worst part is that sometimes I feel like a salesperson. I feel like I have to sell everything that I'm offering, not because if I was I am a human, but if I walked into my doctor and my doctor said, I need to do X, Y, and Z on you, and here's your referrals, I mean, you're doing it. You don't question it. Maybe some people do, but you don't question it really, you just do it. And for me, if I walk in and say, your dog is vomiting, and we need to do blood work, x-rays, we need to potentially do an ultrasound, and everything is like, well, how much is that going to cost? And what is that going to do? And why do we need to do it? And so I'm always on the defense. I'm always having to prove why we need to do certain testing. And that's something that's probably the worst part of it, because sometimes I just want to be a doctor. I don't want to have to sell why I need to do what I need to do. But that's ultimately part of the profession, but that is probably one of the not so much fun parts. And that's why I said client communication is everything, because sometimes clients will do something just because they see you and they trust you and they think you're a good person, and they trust you with their pet. But if you're not a people person and you come across as if you're just doing it for the money, for just to kind of wrap up a bill, that's how they perceive it, even if you are doing the right thing. And so that's one of the challenges. Well, thank you for coming and spending the day in the life of a veterinarian with me. My name is Niccole Bruno again, and you can reach me at N as Niccole Bruno, DVM for Dr. Veterinary Medicine at gmail.com. And I wanted to say thank you to Dr. Webb for doing this series. It means a lot to actually put our career out there and let you see the good and the bad of being a veterinarian. But for the most part, it's an amazing profession, and anybody that wants to get into it, please feel free to contact me, because I would love to help you on your journey. Thank you.